I've been a student of changes in medicine for about 3 decades now, and I've never seen anything like this. It works in whether it's cancer, cardiovascular conditions, neurodegenerative, diabetes, and metabolic conditions across the entire space of medicine. Today, we typically monitor patients very intensively when they're in the intensive care unit. But when they leave the intensive care unit ward, where the only time they get their vital signs done normally is once per shift, maybe twice. They may only have their blood pressure and vital signs checked a few times. And of course, they could be getting into trouble, but it isn't being monitored closely. We've never had that capability in medicine. So this is quite extraordinary.
Sotera Wireless is designing a revolutionary medical device called VisiMobile. It is a small vital sign monitor that is only slightly larger than a sports watch. It's worn on the wrist of a patient.
You know that you're being monitored. You have this guardian angel on you, and you know that the nurse is always connected with you. So even if the nurse is not in the room with you, the device captures all your vital signs and wirelessly transmits the vital signs to your caregiver. So those are events that can be detected early, prevented, ideally, at least caught.
The winner here isn't the technology. The winner here is the patients and healthcare professionals. It increases the quality of the services delivered, it increases the likelihood that bad things don't happen when they're not supposed to, and it increases the likelihood that patients can actually recover better, faster, and cheaper. Initially, this is going to start off in the hospital and then migrate slowly out. We will see the evolution of these kinds of technologies, so they might be something you acquire at the local drugstore. Patients can leave the hospital sooner than they might otherwise be because they can be safely monitored remotely at home. And eventually, someday down the road, I'll actually see the possibility that you'll be monitored before you ever go to the hospital and maybe never have to go at all.